Good afternoon, everyone. My name is Dina Abdellatif, and I'm a consultant nephrologist from Egypt and from Cairo University Hospital. It's my great honor to be with you today and to co-chair this World Kidney Day webinar with Dr. Lily Hsiao. And on behalf of the World Kidney Day Joint Steering Committee and the International Federation of Kidney Foundations, the World Kidney Alliance, and the ISN, it's a great pleasure to welcome you today for this World Kidney Day 2026 webinar. And this one is so special as it's the 20th anniversary of the World Kidney Day. So this year's theme is about kidney health for all, caring for people, protecting the planet. And this reminds us that the kidney health and the planet are so much interconnected. The environmental stresses and environmental factors like heat, pollution, and limited access to clean water, they all affect the kidneys. And also, at the same time, the treatment that support kidney patients and the people living on kidney disease, and especially on dialysis, this consume and require a considerable resource and carry on heavy environmental footprint. So our message is not to put burden on our people living on kidney disease, but it's rather to encourage the healthcare systems, professionals, industry, and the policymakers to work together towards a more sustainable and more patient-centered kidney care. So thank you all for joining us today. Lily?
Good morning, everyone from Boston, Massachusetts, United States. This is Dr. Lily Hsiao, a nephrologist at Massachusetts General Hospital, Brigham. Now we are called Massachusetts General Brigham Hospital, Harvard Medical School. As Dina mentioned, it's my great honor to be co-chair with her with this fabulous webinar. We have fabulous speakers who are expertise in their own right. So I'm looking forward to. And we are also very excited. We have so many people has registered to attend this webinar globally. So I hope you would enjoy it and learn. And I wanted to, on behalf of a World Kidney Day steering committee, to welcome all of you to participate in this webinar. We have received many questions from the registers already. We want to apologize ahead of time in case if we did not post your question. But we wanted you to know we hear you and we see your question. We will do our best to address in some other time due to time limit. So next, I wanted to take a privilege to allow us to hear 2 minutes of message from Dr. Krech, who is the Director of Public Health Promotion at WHO, which will be a recorded message. So give a moment to show you.
Dear colleagues and partners around the world, on this World Kidney Day, we are reminded of how vital kidney health is for overall well-being. Chronic kidney disease affects millions globally, and in many cases, it is preventable. At the World Health Organization, we see every day how these factors impact kidney health. Tobacco use harms not only the lungs and heart, but also the kidneys. Alcohol consumption can lead to high blood pressure and kidney damage. Physical inactivity and unhealthy diets drive obesity and diabetes, two of the leading causes of kidney disease. And we must not forget environmental exposures, which add further strain on health. We all have a role to play through strong policies, public awareness, and personal choices. WHO supports countries worldwide with programs like Empower for tobacco control and initiatives promoting healthy diets and active lifestyles. Together, we can significantly reduce preventable kidney disease. Let us use World Kidney Day to raise awareness and take concrete steps for a world where healthy kidneys are the norm. Thank you.
Now we give the time back to Dina.
Okay, thank you. So let's move on to our speaker. And now we start with presenting our first speaker, who is a very well-known nephrologist and with a highly publishing nephrologist with over 900 scientific papers. He's known for his work for dialysis, adequacy, uremic toxicity, and he will be speaking with us today, Professor Raymond Vanholder. So, Professor Raymond?
Yeah, thank you very much. Can I have my slides, please? Thank you. So I have the task to set the stage and to summarize for you the World Kidney Day editorial, which is published in Kidney International, and which is a plea for sustainable kidney care. And the central message of the paper is mentioned in the abstract and is here with underscore. The current kidney care model focused on late-stage disease and in-center hemodialysis is unsustainable. Next slide. And therefore, we propose a shift from the current model to the sustainable model. Next. And that current model, at the center of it, is the biggest problem, which is in-center hemodialysis. Next slide, please. So what's wrong with our current hemodialysis? Next. Well, it's extremely expensive. Next. It has a high burden on the environment. It has dismal outcomes, and also quality of life is inferior. Next slide. On top of that, if we look at the uptake of dialysis throughout the world, where the blue color is the highest uptake and the dark red is the lowest uptake, there are huge differences. And these differences are to a large extent due to a lack of reimbursement or insufficient reimbursement in many countries. And where there is not enough reimbursement, we get catastrophic evolutions. Or if people and their families try to cover the costs, we end up with catastrophic out-of-pocket expenditures. Next slide. Now, for that reason, we propose another sustainable model, the next, and the key next elements in the new model, next slide, are first of all, prevention and healthy lifestyle, not only healthy diet, but also struggle against obesity, smoking, and lack of exercise. We also now have the luck to have medications that refrain the progression of chronic kidney disease with SGLT2 inhibition, which should be made available everywhere, but we should not forget that also by striving towards an optimum blood pressure and an optimum glucose in diabetes mellitus, we can already refrain progression of kidney disease a lot. However, the need that we then have is to know whether people have chronic kidney disease or not. And for that, there is a need for screening, for systematic screening, and a screening that is early enough. And therefore, we defend the use of albuminuria, which is not frequently used. Also, doctors do not look at urine, and we propose to do this early enough so that the disease can be detected and dialysis forestalled. If kidney replacement therapy is needed, the preferred option is transplantation. Next slide. Or if that is impossible, home dialysis. And finally, there is also a need, next slide, for a greener dialysis model. The next slide. And for that, we have this other summarizing figure in the Kidney International editorial, which is summarizing several possible measures. The next, in the red box, which is horizontal, you see what can happen at the dialysis unit. The next slide. But the important point is that 70% of greenhouse gas emission in healthcare is not coming from the application of the treatment, but from the supply chain. The next slide. And the problem with the supply chain is in the vertical box, that is the manufacturing and the transport. So there is also a huge responsibility with industry. And together with that, with us consumers, that we have to ask and to strive towards the use of the environmentally most favorable solutions. The next slide. That means also that particularly in lower resource areas and in crisis situations, there is a need for more compact and more affordable dialysis systems. The next slide. And in the insert, you see the results of a comparison for greenhouse gas emission, where the surface of the circles is equivalent to the greenhouse gas emission. On the right side, you see ICHD, that's in-center hemodialysis. And on the left side and in the middle are two ways of mobile compact dialysis, more exactly next stage. And it is clear that greenhouse gas emission, but also cost and also quality of life is much better with such a system. The next slide. Now, I'm also aware, or we are also aware of the fact that every country has its own problems and also its own way to solve these problems. So everybody has to grow at their own pace. Next slide. But the major message is that for us as a nephrological community, it's time to turn the tanker. Next slide and last slide. I thank you for your attention.
Thank you very much, Raymond. That was a fabulous beginning to set the stone. Our next speaker is Gloria Munoz, who is a kidney nurse specialist with over 22 years of healthcare experiences. And she also holds a master's in global health and social justice. She's the leader in a sustainable kidney care education and policy in the UK. So, and rightfully so, the title of her talk today is Introduction to Sustainable Kidney Care. Gloria.
Thank you very much for the introduction, and good afternoon, everyone. From London, the United Kingdom. I am just about to share my slides, so please bear with me. Fantastic. And my task is just to give you a brief introduction to what sustainable kidney care is. Sustainable kidney care is having the ability to meet the needs of the current population without compromising the health of future generations. It's about understanding that human health and the planet health are intrinsically linked, acting in ways that support or impact one another. The principles of sustainable kidney care range from prevention, which is the most powerful principle because we are preventing chronic kidney disease in the first place. And this couldn't be more imperative if we look at the most recent update of the global burden of chronic kidney disease conducted by Dr. Ortiz, Alberto Ortiz and colleagues. They are estimating 1.5 million deaths, which translates to one death related to chronic kidney disease every 20 seconds. But really, the journey of sustainable kidney care starts with patients. So that means patient empowerment. It is crucial. Everything we do to increase their skills, knowledge, and confidence to take autonomous decisions. Lean pathways, by doing a very simple process mapping, you can identify waste, duplication, and remove it from clinical pathways. We then have low carbon alternatives. This is all about prioritizing treatments and technologies with a lower environmental impact. And then we have a fifth principle not listed here, and it's how we use our buildings, how we design our pathways to utilize those buildings, electricity, water, and so on. Next slide, please. This is just to establish where we're at. We've had very difficult years. We are still dealing with the effects of COVID-19, now dealing with the cost of living crisis, which is very much distracting us from the major threats, climate change and biodiversity collapse. And these two are impacting on every aspect of our lives, just because the delicate ecosystems providing us with water, food, and air have been pushed to their limits and our survival is at stake. Next slide, please. So in 2022, IPCC, which is the Intergovernmental Panel on Climate Change, gave us a final warning. And they are also reminding us to remain in the 1.5 degrees pathway. Next one, please. And this is a list of the impact of climate change in human health. If we start with air pollution, it's important to highlight it's not caused by climate change, but it has the same origins, which is the burning of fossil fuels. Air pollution accounts for 8 million deaths globally every year. If we look at heat waves, let's go back in time. Summer 2022 in the United Kingdom, there was a heat wave causing 3,000 excess deaths and also exposing the fragility of the NHS or the healthcare infrastructure. IT systems and scanners had to be shut down because of the heat. There were more than 5,000 clinical cases reporting unsafe temperatures. So it was difficult to store medications. It was difficult for patients as well as for clinicians. And this is crucial because heat affects our cognitive function and we need to make critical decisions. It's also a risk factor to develop acute kidney injury. Next slide, please. So this is just to highlight the climate justice we need to address. 50% of the global poorest population are responsible for 10% of the CO2 emissions, whilst the 10% global richest population are responsible for 50% of those CO2 emissions. Next one, please. So why is this so relevant to healthcare? Ironically, healthcare is part of the problem. And if global healthcare was a country, it would be the 5th largest emitter on the planet. And that means we need to decarbonize. Next one, please. So in 2016, the Royal College of Physicians identified sustainability as the 7th domain of the quality of care we deliver. Next one. And how can we impact on patients, colleagues, communities, societies by using our trusted voice? Year after year in the United Kingdom, nurses and doctors are voted as the most trusted public voice. And this is very important because we can impact and we can accelerate action. Next one, please. So I think every one of you in this forum today can contribute to something amazing to society if you join the movement. And please reach out if you have any questions, you need any guidance, and so on. Thank you for listening.
Thank you, Gloria. And now we move to Fiona Loud. Fiona is a policy director at Kidney Care at UK and Kidney Care UK and a leading advocate for improved kidney care policy. And drawing on personal experience, she focuses on transplantation, access, organ donation, psychosocial health, and patient choice. And she has been widely recognized for her contributions to the kidney community. So, Fiona?
Thank you. Excuse me. Thank you very much indeed. And I hope you can all see my slides. And thank you for the opportunity to speak today to talk a little bit more about what some of this means to people with kidney disease. I'm calling this talk prevention now because I'd like to very much focus on that aspect of what this could mean to the planet, but also very importantly to people. So while I'm policy director for the UK Kidney Patient Support Charity, Kidney Care UK, I'm also a member of the ISN Patient Liaison Advisory Group. So, and one thing I should say actually, is that while this is 20 years of World Kidney Day, it just occurred to me that this year, at Christmas time, will be 20 years since I had my kidney transplant as well. So hopefully it's a good year. All right, so we heard from Dr. Krech at the beginning of this a little bit about the World Health Organization. I just wanted to point to the fact that in 2025, we had something really helpful, which was that the WHO and its members agreed that chronic kidney disease is a priority. It's the 5th leading cause of death worldwide from non-communicable diseases, And that was followed up after a lot of campaigning by many people, including the ISN, very, very helpfully, that a political declaration which 175 countries accepted and asked for this kind of thing. So it's strengthening primary healthcare and community-based services to improve promotion of health, prevention, screening, diagnosis, and so forth of a number of conditions, some of which, such as hypertension and diabetes, are very much a part of chronic kidney disease and chronic kidney disease itself. So I think that's something to be very much encouraged about. So let's go on now and just talk about, from the point of view of those of us with kidney disease, but also you all as an audience and people across the world. If we don't address chronic kidney disease, then the transplant list, which is at its highest in the UK at the moment it's ever been, will continue to get longer. If we don't address CKD, dialysis units, yes, we are fortunate in the UK and many parts of the world, but not all parts of the world, to have dialysis units, they will run out of capacity. If we don't address CKD, more lives will be lost unnecessarily, and there are things we can do if we pick it up sooner. So the very most sustainable thing we can do for ourselves and for our planet is to detect and prevent, or at least slow down, kidney disease. 10 years, in 2015 in the UK, 19 people a day faced kidney failure. By 2025 now, it is 24 people a day. So the UN has taken notice of chronic kidney disease, and we're asking all of you and for you to reach out to people in your nations to take notice of chronic kidney disease as well. So I'm just going to do a couple of slides about a campaign we've been running on prevention here in the UK, called the Bloody Amazing Kidneys campaign. So it started on social media back in October 2024, based on the fact that so few people in the public know about kidney disease itself. The symptoms aren't obvious until you get to later stages. So many people just don't know about the condition, but it affects up to 1 in 10 of our population. And you can lose function without realizing. So this artwork is meant to demonstrate, as the blood becomes more dirtier, how the kidneys are filtering less and less efficiently as you progress through the condition. And something else, we actually place these posters with their QR codes to take you to a simple kidney health check, so you could learn more about your own, keeping your kidneys healthy and your possible risk of the condition. So we put those in washrooms as well. Last October, just 2025, we were fortunate enough to receive the support from a community channel partnership, which meant that these banners, these posters, were out across the UK on the motorways and in the streets, so people could really see about kidney health. And that was something that we felt that was absolutely part of promoting that, as well as promoting the health check. So what do we learn from that health check? Half of the people who took part in it identified as having chronic kidney disease risk, mainly through high blood pressure, but also through the use of drugs like ibuprofen as well. Just like to point out to the fact that over nearly 300,000 people, I hope it gets to 300,000 by World Kidney Day, have now taken the checker. But that those people who did take part, remember this was through social media, it wasn't aimed at people with kidney disease. They were over 60, which represents, I guess, the age at which many people will learn about their chronic kidney disease and start to develop it more, but not exclusively. Some of us, like me, have a rare kidney condition instead. And that most of the people, in fact, were either overweight or obese, which kind of comes back to some of the potentially modifiable factors we can do about this. So here's a link to the checker. And I'd like to move on now to a bit more about what patients think of all of this. They really do want kidneys to be put on the map, and they want to know about their condition early from primary care, with explanation about what it means to them. They don't want to find out late that they had it and they could perhaps have done something about it, whether lifestyle, whether through treatment previously. And they want that prevention to be prioritised, including for children. And how do we know this? Well, we asked them, and I've put at the bottom a link to a report surveying that, sort of summarising that survey of people with kidney disease and what they really want. But for those with advanced disease, I've picked up a couple of things around sustainability that just for us to think about, which is people will want those choices which can give them more time. So, for example, dialysis at home, transporting to dialysis at 6 journeys a week is not a great experience. So having your dialysis at home, provided perhaps we could reduce the rubbish that goes along with that, is potentially certainly more convenient and more sustainable. And another thing could be transplant workup. So we often have in this country multiple assessments and lots of journeys for potential living donors. There's some great practice, but it's not consistent. So that could be something else to think about to kind of make that both more convenient and more sustainable. All of those things will be better for the planet as well as for the individual. And finally, something we can do is we can go to our policymakers. This is outside our parliament, our national parliament in Westminster, and that's H and Annika, both of whom developed chronic kidney disease through uncontrolled high blood pressure. And so taking those stories to our policymakers is another way to explain, personalize, and convince them and the world that chronic kidney disease needs prioritization. It needs to be picked up sooner so that deterioration can be prevented. And that is better for us, and that is better for the planet too. So thank you very much, and I'll hand back. Thank you.
Thank you so much, Fiona. That was a fabulous. Indeed, you convinced me already. Prevention is so important. Yes. Our next speaker is Dr. Augusto Santos Jr., who is a Brazilian nephrologist, also associated with in academic affiliation. It's a long name, so I'm going to just use the abbreviation FCMMG and UFMG. I guess we'll have to check it, see what the full name are. Augusto also has a master's degree and PhD in health science and completed executive training at Oxford and an MBA at Imperial College in London. So Augusto's title today is From Detection to Action. Also equally excited to hear what he will tell us. Augusto?
Thank you so much, Lily. Good afternoon, good morning, and good evening to all participants in this webinar. So thank you so much for the invitation to participate. I'm really pleased, and then for the kind introduction. Okay, great. So in the next few minutes, I hope to discuss how we can connect detection to a structured action plan to transform kidney care at scale. As already mentioned, around the world, millions of people are diagnosed with chronic kidney disease, and the real challenge is what happened next. I work in Contagem, which is a city based in the state of Minas Gerais, Brazil, with approximately 650,000 inhabitants. And like many other regions globally, we face a paradox. So patients are detected late, referred late, and often start dialysis in urgent conditions with avoidable complications and higher costs. Our recent data has showed us that nearly 90% of patients start dialysis hospitalized, and only about 5% of patients have a functioning arteriovenous fistula. So this is not only a clinical problem, that's also a problem in our system. With these numbers in mind, at the end of 2025, we decided to reformulate our strategy. So our goal was to build bridges between the primary care and nephrology, and the core problem was our lack of coordinated pathways from detection to specialized care. We needed to move from the fragmental healthcare delivery to a coordinated model where patient is at the center, and transform this kidney care from a reactive to a proactive strategy. To make this possible, we implemented a teleconsultation program, and also we revised our clinical protocols to foster early detection, to allow timely referral according to patient complexity, and also to allow guided transitions. The result that we are getting gradually is to transform kidney care into a continuum. Patients with kidney disease are now systematically flagged in the primary care, and our mission is to ensure that follow-up and coordination is at place. Creatinine has become our universal language, and in this model that begins with the primary care, with early detection and risk stratification. Actually, what we are trying to do is to build a team-based pathway so that patients are no longer simply referred to nephrologists, but instead nephrologists are connected to the care of these patients, supporting primary care teams and enabling multidisciplinary approach. So I personally strongly believe that these systems connecting all these personnel will eventually improve our outcomes, and I'll be very happy in the next few months or years to come along with some objective numbers showing what has we accomplished in terms of success concerning the delivery of care to patients. I would also like to highlight some other important initiatives that are also happening in other institutions. And one, the International Society of Nephrology, which has just published a new core curriculum and to empower non-physician healthcare workers on early kidney detection and care, and the Brazilian Society of Nephrology that has initiated a pioneer program aimed to connecting nephrologists to primary care physicians. In both cases, the concept is quite simple. So most patients with chronic kidney disease are managed in primary care, and connecting primary care with nephrology expertise will foster early identification of high-risk patients and timely intervention. So the idea is that primary care cannot work in isolation, and this is where really the action and the detection becomes action. And finally, what we are aiming at, and so in summary, is that we are doing what we are doing is to replace the patient to the center of our actions, and by doing so, we are being able to reduce the waste of resources, increase efficiency, improve patients' outcomes, strengthen our healthcare systems, and of course contribute to environmental sustainability. This transformation is only possible because of awareness, structured pathways, integration between nephrology and primary care, and of course the support of healthcare policies. So I would like to finish with the message that the detection without action is a missed opportunity, but I'm quite confident that detection with action will transform kidney care globally. I would like also to invite all participants to join our joint session, ISN World Kidney Day, that will take place at the World Congress of Nephrology. Thank you so much.
Thank you. Thank you, Augusto, so much. And thank you for all the speakers for those stimulating presentations. And I think this opens for the discussion now, and we have about half an hour now, or 25 minutes for a discussion. So me and Lily will go through your questions and also the questions that has been sent during the registration. So if I may start for all the speakers, and maybe I would start with Ray. The World Kidney Day editorial this year highlights that the current kidney care model is economically and environmentally and ethically unsustainable. So in your view, what is the single most urgent change that must happen in the next 5 years to move forward to a model that is more sustainable? So I will start with Ray, and maybe we can also hear the opinion from the rest of the speakers.
Well, to my opinion, the most important thing is screening, but early screening. So as I emphasized, this is by way of albuminuria. Of course, creatinine, I think, is also very useful, but it comes later. So the earlier we are, the more we can prevent kidney disease to progress. This should happen in a systematic way. And to my opinion, in the general population, not only in people at risk, because we know already those people at risk, but this needs to be followed with education of the public and of the doctors and other medical professionals about the meaning of it and also the appropriate measures to be taken when screening is positive. Thank you.
Okay, thank you. So anyone from the speakers would like to add something? Augusto. Okay.
So one of the things that I think that I could add to this is that we also need some reimbursement reforms. So usually what we see is that the model is very much focused on the reimbursing dialysis and not prevention. That's especially important in lower middle income countries. So it's really a missed opportunity because actually when we look into the cycle and the system, it's the prevention and care of early stages are almost invisible, and you know, shifting the focus from procedures to uh, the patient care itself, and promoting teams and connecting those teams is possibly the key answer for us to intervene earlier, have better results on prevention, especially now that we have important tools to stop progression of kidney disease and prevent patients to be detected only on late stages where holding the progression is more difficult.
And regarding the current kidney care or the current treatments that we have got for the people living on dialysis or on renal replacement therapy, so what would be the first action that we should take regarding those patients or regarding the treatment that we have got? Maybe not every unit, not every center they are using. So do you think of one single thing that we at least can start with? Maybe this for Augusto and Raymond also, because we are in the authors, the co-authors for the editorial for this year.
Yeah, I would say that it's just always especially important to have the creatinine exam and the simple urinary test, the protein creatinine ratio in mind. So to make this an universal language and bring this, especially for those who are at higher risk, the population that we know have higher rates of chronic kidney disease. This is together with empowerment, education, and more sustainable healthcare systems is the key to shift the focus and have a globally better outcomes in terms of stopping the numbers that we are seeing in terms of and kidney failure requiring renal replacement therapy.
I actually
Thank you.
very much appreciate Raymond mentioned screening is incredibly important. It should be eventually make it into a priority. Particularly important is checking urine, right? Proteinuria. Like Augusto mentioned, ACR, even PCR, we need to educate it. Community population, also the healthcare provider. the teamwork, which is the concept Brazilian is to introduce it, which is brilliant. Perhaps we need to talk more in the future. So here actually I have a question for Fiona. So from the global perspective, we're talking about the disease prevention. So talking about equitable kidney care, if you can elaborate a little bit more, and also there's another question with what role should a patient organization or kidney foundation play in shaping prevention message and advocacy? Yeah. I love your title. Kidney is a bloody amazing organ, right? Yeah,
yeah, that's a good campaign, because when they're not so amazing, we really do know how it feels, don't we? And we want to stop that. So thank you. So a couple of things. I absolutely agree with Augusto and Ray on the earlier screening piece. And we have fallen back because we used to have an incentive system for primary care to do that testing, the albuminuria testing. And when it was removed, the rate of testing halved overnight. And this was 10 years ago. And it's only just coming back to, and it still hasn't reached where it was before. So I do agree that empowering and educating, and if you can offer some incentive for primary care to find out about people's chronic kidney disease, especially for those people who are at risk with diabetes, with high blood pressure, with a family history. These are some good places to start with. Now, flipping at not the other way, but moving along, for people who are at risk of those conditions, this is part of the role that an organisation like ours at Kidney Care UK can do. And so, running a campaign, providing the best you can of patient information so that people can go in and find out the questions to ask and learn about their kidney health and receive some reassurance as well, because it's a very difficult journey. So that can be, mental health support, can be financial guidance and support, or things like that. So there are a different range of things that you can do to empower people who are at risk, people in families with these conditions, to do that. But we can also take the role of working with our healthcare professionals to tell the patient stories, and by personalizing what this means to an individual and what they wanted or what they would want for their families, or if they had another chance, is a really good way to reach those policymakers and convince them that this is the time, because we now have the best opportunity we've had for a long, long time to change the future, even if we can't necessarily change the past. So many of us are absolutely passionate about this, and many of the kidney doctors that I know and the nurses want to see that as well. But it is across the community. So it's not just, I don't mean just in that way, but not just when you arrive at kidney care, kidney failure, because it's kind of, you've missed that opportunity, but it's for those people before as well. And so at our charity, we now hear from, probably about 20 to 30% of the people we hear from are now people with earlier chronic kidney disease, which actually gives you an idea of the shift and the possible interest in those conditions.
Ray, would you like to comment on the urine tests and the difference between the proteinuria and albuminuria?
Yeah, just very briefly, because there seems to be some semantic confusion between the two terms. Proteinuria is not as early as albuminuria. It's good to detect nephrotic syndrome, but it's not good for what we want, which is very early detection, and not only detection of chronic kidney disease, but also of its risk factors, diabetes, hypertension, and cardiovascular disease, so that we can intervene early. So that's just a point of confusion. As a matter of fact, it doesn't cost very much for the time being. It's maximum €5 in Europe, and that's really an overcharging of the real cost. So we have to reduce the costs for society. That's it. Thank you.
Gloria, you want to say something?
Thank you. So just expanding on what everybody has said, so it's kind of linking the dots. Education is very important. It's a social determinant of health. So we need to educate not only the patients, we also need to educate more our colleagues, so nurses, doctors, and so on. And then I just wanted to stress on equity and access to screening. This is very crucial because I think I have been privileged as a kidney nurse working in environments where we have provided community clinics, meaning moving resources, doctors and nurses from the nephrology, from secondary care into primary care. So we were doing these clinics for general practitioners, patients. And that was very crucial because we could see the outcomes of those, and screening was important. And something else I want to mention is calling for a consensus on when we should be screening for albumin creatinine ratio for children. So there is no consensus. As far as I know, it is done when they are in the nephrology clinics, but there is no consensus when to do it routinely in primary care. So I think this is also very important. Kidney care starts before adulthood, so it starts with children, and even before that with intrauterine life. So it's closing, all of the gaps. Thank you.
Yeah, and this can lead us also to one of the questions on the chat, which is screening all versus targeted screening, especially in the low resource settings in the low middle income countries, and what is the preferred strategy for sustainable kidney health. So maybe this also adds to your question, and when should we or who should we screen? Are we screening the whole community, or we're screening the high risk population, and especially when the resources are limited? So maybe also you can share your opinion. Ray?
May I jump in? I agree with Raymond. Checking the urine actually is not expensive. It's quite cheap. The current healthcare system is overcharged. Okay, and don't mean to promote it here, but I created a community outreach program called Kidney Disease Screening Awareness Program. We went to underserved population. We screening those risks, diabetes, hypertension, obesity, include checking urine, and we do albuminuria, semi-quantitative. Is all free of charge, and that's part of the effort to reach out to the underserved population, or to answer the question from the audience. So just want to, I think screening truly global is lacking, and we just need to think about how to promote this concept.
And the question here is who to screen. So I was screening the whole population.
Yeah.
And this,
so
yeah.
that's So I think a lot of this is a policy issue. Okay. I don't want to take away the time from our speaker. One, someone need to do it cost effective. It's not for the community. Man is a convinced policymaker to say this is worth it. Okay. I think we should, just like doing a colonoscopy, we should have a general rule who we should start it, and then whoever positive, how often we do repeat it, where to refer to, because like we mentioned, some people started even in the as a fetal stage, and somebody developed very early. So how do you set the rule? And so it's an interesting area of need to be further discussed. Raymond, you raise your hand.
Yeah, just a brief answer to that question. I think any screening is better than no screening. And it's depending, of course, I think the situation of every country is different. But my concern with screening risk groups is that you also already know that they are risk groups. So the albuminuria thing is something that is very useful to find people who have not been detected, no blood pressure detected, because all this, in fact, every factor, also blood pressure, etc., glycemia, everything has to be looked at. But I think for community screening, it's easier to do this, for instance, together with screening for colon cancer, and then to take an as large as possible population. That's the cheapest way, and also the best way to preserve people people's kidney function and to avoid that they come to dialysis. I think the concern is also that many countries are investing in dialysis and put a lot of money into that. That could be better put into preventive measures and into screening.
Thank you, Raymond. Music to my ears. All right. So we actually, let me see. Here has a question for Gloria. Can you give a practical examples to show that the sustainability and the high quality patient care can go hand in hand?
Prevention and community clinics. This is when I would emphasize. And I would like to mention, for example, the hidden chronic kidney disease study, in which you go out there to public spaces to do some kind of a screening, and then you are identifying patients that didn't know they had chronic kidney disease, and their healthcare providers or GPs didn't know either. But then you start, putting all of the interventions in place for this patient. And I would say patient empowerment is the example I like the most, because this is where the journey really starts. So anything you do with the patient to give them the tools, you impact on their skills, knowledge, and confidence, and they can start taking autonomous decisions, control of their health and conditions.
Thank you, Gloria.
And there's here a question in the chat from Manjusha Yadli. And Manjusha is also a member of the World Kidney Day Joint Steering Committee. And she was asking about the strategies to strengthen the home dialysis, especially in the low-income countries. And this would help in more sustainability. So if Raymond and say Fiona also has her hand.
Sorry,
so how can we increase the uptake?
But I can briefly answer. I think with home dialysis, I meant particularly peritoneal dialysis, and I think that's perfectly feasible. Also in low-resource countries, home hemo is of course more difficult, but for that I think systems must become simpler and cheaper. And then you can go to places where now no treatment is actually occurring. That's it. That's all. I will shut up now.
Okay.
And my comment, was actually going to be in response to Gloria's comment, but I'll comment on that as well, because PD is potentially the only way that even there's some sort of doorway to that in some nations. But appreciating that some nations barely have any dialysis at all, it's an absolute imperative to look at detection, prevention, and not to be scared of it, because sometimes people talking about patients don't want to know about these things. There's a cultural thing about it as well, and obviously if we just ignore it, unfortunately it doesn't really go away. So information is available. There's information for the ISN, there's information through all the charities and organizations like ours that people can look at to learn more about their conditions. And if for some people there are some things, whether they are lifestyle, whether they are treatments, that can go in sooner, and that's not a solution, but it's a form of progress that we can take. And one other thing, just about sort of patient empowerment, the public barely know anything about chronic kidney disease. And if you'll forgive me for saying, when we did a study not that long ago, and I know others have done the same, most people don't even know where urine comes from. So if you don't know that basic fact, then you are not going to understand how important it is to preserve your kidney health. So that's a place where we can come along to. And I know I've seen that European Kidney Health Alliance used, Tina Turner, incredibly well-known star. I know she's passed away now, but sometimes there are people like that. Selena Lopez, some of the most famous people with kidney disease in the world have been able to do a huge amount by just perhaps reaching other places to prompt people to go in and go, hang on a minute, what are those kidneys? What do they do? And how can I look after them? And then finally, even when, just to respond to Ray's point, even when it is known that people have things like high blood pressure, people don't know, they fall through the gaps, they don't receive their kidney checks. So I think there's something that we should be doing, we should be doing many of these things, but a place to go to first. We know that, just 30% of people in the UK who have high blood pressure, only about 30% of them will go on and get kidney checks. And I'm sure that's similar in other places as well. So that's really, it's a horrible phrase, low-hanging fruit, but it's something urgent that can be done more quickly, as well as the other things we talked about.
Thank you, Fiona.
Yeah,
So,
as a physician, on the end, we see patient when we break the news to patient about their kidney has failed. It's a huge emotional breakdown, and we see that repetitively. So that says how important to empower patient, and also education, how important education bring into the community level. Yeah. We have Gloria and Augusto. Gloria, you go first.
Okay, quickly, I just wanted to say, yeah, management of risk factors is crucial. I used to do community clinic on hypertension. So patients were referred to us with uncontrolled blood pressure. But when we proved medication compliance, they weren't really taking their medications. And it's because they didn't really understand the risks of high blood pressure. And that is very important. Thank you.
Augusto?
Yeah, I just wanted to briefly add that, especially in low-income countries, home dialysis is particularly important. So what we are seeing in these countries is a steep increase in patients in need of traditional dialysis. We are seeing those patients waiting on hospitals for being discharged to ambulatory care, ambulatory dialysis, and this has become especially important, for instance, in Brazil. Peritoneal dialysis and eventually full selected patients, and having home dialysis is crucial because it's cheaper, more environmental friendly, and also requires less infrastructure. So easy to start and to keep going. So I think this is one of the points that we might see advances in the very near future.
okay, and now we move to some other questions in the chat, and we have here Mohammed Mahsoub, and how can you see the adoption of the digital tools or the AI detection and screening of CKD? So how can we use those tools, or the AI, in helping screening and helping detecting CKD? So this is for everyone.
For everyone.
Okay, right? Yeah.
So I think there are many different ways. One of the first things, which is my concern, is that that people who have low health education do not follow the same channels as other people, and that they need to be informed in a very simple way. So this can be done by cartoons, by messages, by SMS, by videos, small simple videos, etc. Then I think that also the screening can be coupled to apps, but that's maybe more sophisticated, and that in this way the interpretation can come already at the first stage automatically. I think there are also warning systems which are very important for development of chronic kidney disease. And finally, we have telemedicine, telehealth, with information that can be provided to primary care physicians and also to other people who are in the first rank of care provision, pharmacists, nurses, etc., so that the whole community is informed. Thank you.
Thank you. Well, Fiona?
Yeah, this is an opportunity, but we have to be very, very careful because the potential for misinformation is also really high. We've taken a look at the information sometimes that Google serves up, and it's not always accurate. So it might say chronic kidney disease, it might mistake the fact chronic kidney disease stage 5, mortality can be, 5 or 6 years on dialysis, and it might say that for all stages of chronic kidney disease. That's the kind of thing we've seen, and that can distress people. And of course, it's not accurate. If you have early chronic kidney disease, you can have a completely different outcome. So I think we have to treat it with a great deal of caution. I think there's opportunities. We talked about apps. So, for example, in the UK, we have something called the NHS app. So you can do everything from register your organ donation decision on it to receive information about appointments and the results of your tests. So it's good. But we've also found people are discovering they've got chronic kidney disease through the app, and no one had ever told them about it. So they get quite angry about that as well. So I guess I'm saying that there's some really good things that could be done for this, but I think we need to be aware that the opportunity for misinformation or for people finding out things without being told about it first exists as well. So a little bit slowly, a little bit cautiously.
Yeah.
And I
Augusto?
think that people need to have the correct information available and easily approached through the right channels.
Yes.
Before the doctors go and check it or look for it at the ChatGPT or other sites. So we have actually now we have to double our effort, and we have to provide whatever information, correct information that we need the public to have. And here,
patients,
and that's actually as I'm representing the IFKF. So I think that there's a big role here on the foundations, on the kidney foundations, together with the professional societies, to make sure that the correct information is reaching everyone and in an easy way, in a reachable way. Just as the other ChatGPT or others.
Right.
Patients need to know about their diagnosis, but what does it mean to them, not just what does it generally mean. And that's where the healthcare professional in primary care, or indeed later on in nephrology care, is needed.
Right. Okay. So our time is getting up. I think it's why don't we Glory's hands up? Glory, you do the why don't you take the stage? Yeah.
Thank you. Just wanted to comment on one, going back to education. I'm a strong advocate of education, but I very much prefer humanizing education. So that contact between human and human is very powerful, and also bringing patients together. They can get the patient experience, and it's very impactful because it can help demystify treatments and so on. Then in terms of the technology, I think particularly for those low resource settings, it would be good to use it as risk stratification aid. So it will help you kind of filter who can be screened and so on, just when you have issues with allocation of resources and money. And then the technology can be given back to patients to take control. So as Fiona pointed out, this platform we use here, so for patients to access their clinic letters, so they can have access to the plan. Then closing the gap in communication between the clinician after the patient left and then receiving the letter, so it doesn't get lost in the post and so on. Those were my comments. Thank you.
Thank you, Gloria. Unfortunately, our time is up, and we wanted to thank all our speakers and my co-chair for this fabulous session. And we got a lot of questions. Those we apologize if we haven't had a chance to pose your question to our speakers. We're going to save your question and do our best to respond to you. And again, thank you. Include myself, I learned a lot, and it gets me excited. 2025, start 2025 and 2026 truly is a good year for kidney. I think all of us agree, okay? And we just have to continue press on it. Again, thank you so much for everybody, for those who come to attend this session. Thank you for your time, and we hope you equally learn and enjoy the message from our speakers. So we want to end our session. Yeah, okay.
Thank you, Lily. I would like to thank everyone who was attending. And there is still some questions that are not answered in the chat. Maybe some of them have been already included in our discussion, but we will try to have those questions and reply to them on the blog. And just please just keep on logging to the World Kidney Day page, and we will try to provide maybe through the blog we can reply to those questions. So I would like to thank all the speakers, my co-chair, Lily, Hsiao, and anyone want to say anything before we close?
Happy World Kidney Day when it comes.
That's it.
Happy World Kidney Day, and happy the 20th anniversary. Okay.
That's right. March 12th,
so this is
2026, World Kidney Day.
Yes.
All right. Goodbye, everybody, and thank you for coming.
Thank you for the opportunity.
Thank you.